States with strict abortion bans feel the people know too much, so they are moving to cover up and hide important information because they know it would mobilize us all to fight. My name is Brittany Page, and this is The Page Perspective. I'd really appreciate it if you would take just a moment to subscribe to my channel here. I recently passed 68,000 subscribers, which is really exciting, but I'm trying to get to that benchmark that everyone talks about, that 100,000. So please share this channel with a friend you think would enjoy it, and even with someone who you think might, hate watch. A hate watch is still a view, right? So since Roe was overturned in 2022, and even before that, when Texas implemented their abortion restrictions through SB 8 in September 2021, I have been talking about the consequences of abortion bans. During the presidential campaign, we heard many stories from women who had to flee red states in order to obtain necessary care to save their lives and protect their future fertility, or from doctors who feel they can no longer practice medicine in red states with abortion bans because evidence-based care is now a felony. Doctors who have moved to other states, creating maternal healthcare deserts. And through essential reporting from ProPublica this year, we've learned of what is now several confirmed preventable deaths from abortion bans in both Georgia and in Texas. These are the only ones that are confirmed so far, and we are surely to learn of more in the days, weeks, months, years to come. But Republicans in states that have implemented these bans fear that. They fear the general public learning the truth. And so they're now taking disturbing steps to conceal the truth from the public. One reason we know about these deaths is because of maternal mortality review committees, essential committees in states that review maternal deaths, determine the cause, whether the death was preventable, and then make suggestions for how to reduce the deaths. And in September, ProPublica reported on the deaths of Amber Nicole Thurman and Candy Miller in Georgia, after having obtained reports from Georgia's Maternal Mortality Review Committee. Now, the 32 members of that committee have been fired. Reading from ProPublica, quote, "Confidential information provided to the Maternal Mortality Review Committee was inappropriately shared with outside individuals." Dr. Kathleen Toomey, commissioner of the State Department of Public Health, wrote in a letter dated November 8th and addressed to the members of the committee, quote, "Even though this disclosure was investigated, the investigation was unable to uncover which individuals disclosed confidential information. Therefore, effective immediately, the current MMRC is disbanded and all member seats will be filled through a new application process." Now, how disturbing is this? Reporters gain access to information to inform us, the public, of the horrors of abortion bans, and Georgia responds by firing every person who is investigating the deaths of mothers, fires the professionals who are working to make healthcare for mothers and babies more safe. They write reports and provide information that results in changes in hospital policies, for example. You may remember in a previous video, I talked about Idaho's Maternal Mortality Review Committee, which was disbanded for a brief period, and this was covered in the ProPublica article too. Quote, "Idaho let its Maternal Mortality Review Committee legislation expire in July 2023. Effectively disbanding the committee after lobbyist groups attacked members for recommending that the state expand Medicaid for postpartum women." So what is it that these red states want? Do they want these medical professionals to make recommendations and reduce the number of deaths of pregnant women and those who die up to a year after pregnancy, or not? It seems like we are getting our answer today, huh? Reading again from ProPublica on the firing of Georgia's committee, quote, "The health department's letter states that there could be new steps to keep the board's deliberation from public view. The letter said officials might change, quote, other procedures for onboarding committee members, better ensuring confidentiality, committee oversight, and MMRC organizational structure. Georgia's had 32 standing members from a variety of backgrounds, including OBGYNs, cardiologists, mental health care providers, a medical examiner, health policy experts, and community advocates. They are volunteer positions that pay a small honorarium. And the line that's most concerning to me in that is the reference to change procedures for onboarding committee members to ensure better oversight. All that says to me is that they are going to select people who will fall in line, who are not willing to push against the system to improve people's lives, to try to save lives, but to do whatever Republican Governor Brian Kemp wants, whatever the Republicans in power want. And you might think, let's not get conspiratorial here, but let's not forget who Texas appointed to their Maternal Mortality Review Committee just this year. Dr. Ingrid Scope. Reading from the Houston Chronicle, quote, "The Texas Health Department has appointed a vocal anti-abortion OBGYN who helped defend the state's abortion bans to a state committee that investigates maternal deaths. The selection of this doctor comes amid warnings from patients and doctors that Texas's strict abortion laws endanger women by cutting off access to comprehensive care. The now 23-member committee is currently reviewing pregnancy-related deaths in 2020 and is expected to assess the effect of abortion laws in the coming years, including whether deaths have resulted from a lack of access to the procedure." Yeah, so when Georgia says they will change their procedures for onboarding committee members to better ensure oversight, confidentiality, and organizational structure, is this what they mean? Appointing anti-abortion activists to the committee? This is a woman who attacks ProPublica for reporting on the realities of abortion bans and spreads misinformation in the process because she's motivated by her own personal bias against abortion rights. And she's the one investigating the deaths from abortion bans? What are we doing here? Well, Texas appears to be following Georgia's lead when it comes to messing with the Maternal Mortality Review Committee, and not just by appointing this anti-abortion activist, doctor. ProPublica has also recently reported on the deaths of women in Texas, not just Georgia, including a recent article about a third woman in Texas who died after doctors delayed emergency care. So that's 5 deaths total. ProPublica has now reported 2 in Georgia, 3 in Texas. But now Texas isn't going so far as to dismiss their Maternal Mortality Review Committee, but according to the Washington Post, they are skipping the review of maternal deaths in the first years following the state's abortion ban. Quote, "The Texas committee that examines all pregnancy-related deaths in the state will not review cases from 2022 and 2023, the first 2 years after Texas's near-total abortion ban took effect, leaving any potential deaths related to abortion bans during those years uninvestigated by the 23 doctors, medical professionals, and other specialists who make up the group." In a September meeting, leaders of the Texas Maternal Mortality and Morbidity Review Committee said the change was made to, quote, "be more contemporary," allowing them to skip over a backlog of older cases and review deaths closer to the date when they occurred, and therefore offer more relevant recommendations to policymakers. Doesn't sound right, does it? But hey, I'm not a doctor, I'm not an OBGYN, I've never worked on a maternal mortality review committee, so let's turn to a doctor, an OBGYN, someone who has worked on committees, who is quoted in this article, and see what she says. Veronica Gillespie-Bell, an OBGYN and national expert on maternal health, called the Texas committee's decision not to examine cases from 2022 and 2023 bewildering. The idea that the Texas committee would need to skip 2 years of cases to be more up-to-date in its review, quote, "doesn't sound like an explanation that makes sense," she said. Yeah, I agree. It doesn't make sense, especially when you take into context everything else that I've talked about here. And this comes back to the saying that I have up here behind me. Poverty is a policy choice. Everything is a policy choice. I think people listen to these topics and they think it is divisive to talk about politics, divisive to talk about these issues. But we're really talking about right now is whether someone can access healthcare, whether a doctor can practice evidence-based medicine, whether medical professionals can make evidence-based recommendations that improve policies and save people's lives. That just so happens to be related to policy, related to politics. And sure, politics can be divisive, but we've got to deal with reality on reality's terms here. If politicians are interfering with such fundamental aspects of our lives and existence, It is important for us to pay attention, stay engaged, and raise awareness of these issues so they cannot get away with their blatant attempts to hide and cover up the truth. What do you think? Call me and let me know, 657-464-7609, or you can send an email to idoubitit@dollamore.com. You can support my work by becoming a channel member for as little as $1.99 a month, and you do that by clicking the join button below, or you can go to patreon.com/idoubtitpodcast. It's almost 2025. We're facing another Donald Trump presidency, and we're going to need each other to protect each other, to look out for each other. I'll look forward to being in the fight with you all in the days to come. Take care, and I will see you next time.